like you to tell us a little bit about the Jonas Center and about the directions that you've wanted. For example, why did you choose nursing?
Norma, why don't you start?
We are about 4 years old. Our foundation is 4 years old. And we were faced with where to invest our foundation money in futures. Is we narrowed it down to two potential places that would give us the room to be very active in the operation and to, do a good job, not just write a check. So that was important to us. And it was actually, I had been working on a charter school for a number of years and was very involved with public school education. So I thought public school education might be of a great interest to us. And we both went to public schools and worked through the system. And there's a big need for encouraging public schools. And the other was nursing. Always fascinated me because I felt that it was neglected, it was on the bottom of the ladder and undernourished from the public's point of view. And quite frankly, I thought it would be a great opportunity for us to pick either of those institutions, education or professions institution, or nursing or public school education. As we were making up our mind and discussing it and coming to grips with it, we found that there were a lot of big names like Gates and other wonderful philanthropists coming to the forefront for public school education, and public school education from the president on down was pushing that. Nobody was trying to champion nursing. So, having made the decision that nursing is great and that they need some encouragement and perhaps some funding from us, we took the jump and jumped into nursing. That's the reason we started with nursing. We've never, ever looked backwards. I think what we did was good. I think we are in the forefront of seeing nursing develop into an enormously more recognized profession than it might have been a number of years ago, and we're excited to be part.
And also, we felt that we wanted to be really responsible. So we wanted to understand what the nursing community saw as their interests. And we convened a large group of hospital administrative people. We convened a lot of nursing school people. And we asked them, what do you see as some of the real needs in your profession? And we had very free-willing discussions with people from many different aspects of the field. And they gave us a whole lot of material about where they saw the drawbacks, where they were concerned about perhaps evidence-based practice or lack of diversity or retention in the field or the salary disparities. And so when we heard all of that, we felt more equipped to kind of address some of these other issues. So we did it very, very responsibly, and we got our toes wet.
It is such a pleasure for me to be working at the Jonas Center. I really commend Mr. and Mrs. Jonas for their philanthropic support of nursing. Nursing is in everybody's life, certainly at every level, and I feel very fortunate to be a nurse by background. I've also been in the business world, starting a home care agency in my late 20s and having 100 employees within 6 months. It was kind of early on the curve, but made it clear to me about the importance of geriatrics and people staying at home and needing more services to be at home. I've also been fortunate to be on the faculty at the University of Maine, teaching nursing and health policy, and also being an elected official, serving in the state legislature, and also a candidate for Congress in 2006. And the best part of that, for me, was actually having a nursing background. And nurses are very respected when they are in politics and in public service. And we need more nurses, social workers, physicians, physical therapists to serve in office. Many times, people are making decisions about healthcare, and they've never really worked with a patient. And it's easy to discuss policy when it's related to budget but if you've really worked with patients and families, you bring a depth of care and concern that informs policy. And I think we get much better political decisions and policy decisions when we have a patient focus.